healthcare digital transformation is mainly focused at, for us the most important thing is the patient records. So one is patient records, another is your medical facilities. Primarily the patient record, we have decided to digitize that, and in terms of digital transformation, our objective was to digitize the entire process from the admission to the discharge, the entire process, digitalize it, and to have a digital record safe and secure and easily retrievable as and when required, and so that the patient even gets the prompt services and the information related to a particular patient is available to every stakeholders who are involved in the direct patient service. So we have rolled out a central HIS system which is integrated with a central RIS and LIS. We have got a captive data center. The entire data is saved in the data center and are accessible from anywhere to those, only to those who are authorized to access, and this is to facilitate better patient care. Quite a few healthcare chain has shown that EHR can be adopted. Yes, it has got its own challenges, but it is something that cannot be prevented, cannot be stopped, and for the betterment of the patient service, this is required, and this is no more a choice. It is a way forward and will be adopted by each and every healthcare institutes across India. In terms of patient record safety, we have ensured that the data are stored properly and secured, and that's why we have taken multiple information security initiatives to ensure that these data are secured from any external agency. These data are completely private and are only visible to those who are entitled to protect the privacy of the patient. Securing digital record has become a most critical requirement these days for the hospitals, because patient records are important. They need to be secured, and patients are entitled to that privacy. Keeping that thing in mind, the latest project that we implemented is a centralized firewall system and data loss prevention system. Both are information security initiatives to ensure that the data is not accessible to anyone or any to drive away any outside threat. It's more of a proactive initiative to prevent any patient data from being stolen. As the trend is in these days that people more and more are shifting toward clouds, and there's a reason for that, because every organization is preferring to invest more in opex rather than in Capex. That helps, because having something on premise invites more investment. It increases the asset of the organization. Instead, the organizations are moving towards cloud, where a third party take care of all the worries related to the retention, backup, and the security of the data. And keeping that in mind, we have also adapted that. We have planned to adapt it, and we are going to integrate our RIS system with a cloud storage system, where the data would be stored as per the compliance, one, and second is that we will not have to invest in a huge Capex year after year, and third is the data would be secured, and there are people who will take care of it.
For more updates from CXO TV, please like and subscribe to our channel.